Hi, this is Dr. Joannides, the Chief Medical Director at Optimum Reinsurance, and this webinar is on mild cognitive impairment, abbreviated MCI. So what's our agenda today? We're going to talk about what is mild cognitive impairment, how do you make the diagnosis, what are word recall and clock drawing tests, how does mild cognitive impairment differ from dementia or Alzheimer's disease, what medications are used in mild cognitive impairment, and what is the long-term outlook for somebody with MCI. So let's get started. So mild cognitive impairment is a condition in which people have more memory or thinking problems than other people their age. So it's a relative diagnosis. The symptoms of MCI are not as severe as those with people that have Alzheimer's disease or related dementia. So mild cognitive impairment is a condition characterized by cognitive decline that is greater than expected for an individual's age and education level, but not severe enough to significantly interfere with daily activities. So it's considered an intermediate stage between normal age-related cognitive changes and more serious decline associated with dementia. So there is a risk of progression from MCI to Alzheimer's disease in about 50% of people within 5 years. So what are key aspects of mild cognitive impairment? Symptoms would be memory problems, forgetfulness, that's called amnesic mild cognitive impairment, language difficulties or trouble finding words in conversation. People, stop in mid-sentence, they have trouble finding the word that they want to use, or they forget a name, impaired decision-making, or visual-spatial skill problems. So the diagnosis of mild cognitive impairment, many family practitioners or internal medicine doctors begin testing their patients at age 70 and older with simple tests like delayed word recall. They may give you a few words to remember or ask you to draw a clock at a specific time. It shows the hands of the clock at a specific time. Or the patient may be referred to a neuropsychologist if symptoms or signs of mild cognitive impairment are present. And then trends are monitored over time to see how the patient improves, progresses, or gets worse over time. And then lab testing or neuroimaging may be done to rule out other causes of cognitive decline. So mild cognitive impairment can have a specialist to evaluate the findings. They may have detailed cognitive testing, such as the Montreal Cognitive Assessment, abbreviated capital M, small o, capital C, capital A, or a mini mental state exam, MMSE, or some other kind of mental status test to assess their cognitive function and see if there's any cognitive impairment. A medical history is taken to determine how the patient is in general and what factors may be present that would indicate a diagnosis of mild cognitive impairment. And then they might want to record changes that have occurred over time, confirmed by a family member or close friend. Physical and neurological exams may be done, as well as certain laboratory tests to rule out other causes of mild cognitive impairment. Brain imaging with MRI or CT scans may be done to look for brain abnormalities. And then memory or cognitive problems that are noticed by relatives may be useful in helping the doctor or healthcare provider to determine what the situation is And then excluding dementia, which is much more severe, is one of the factors which would be used. And then ongoing monitoring with regular checkups. So patients diagnosed with MCI should have regular follow-ups every 6 to 12 months to monitor changes in their cognitive function. So what's the difference between mild cognitive impairment and Alzheimer's disease? So it's important to distinguish how these two are different. So the severity of the cognitive impairment in MCI, the cognitive decline is greater than expected for a person's age, but not severe enough to signify terrible interference with daily activities as would be present in Alzheimer's disease. The number of affected cognitive domains, typically MCI involves problems in one or a few cognitive domains, while Alzheimer's affects multiple cognitive areas. The impact on someone's life, people with MCI generally manage their everyday tasks independently, although they may take more time or be less efficient, which is in contrast to Alzheimer's disease, which significantly interferes with daily activities and independence. And then progression of symptoms. MCI symptoms may remain stable or even improve in some cases, while in Alzheimer's disease, it's usually progressive with symptoms worsening over time. With detailed cognitive testing, with standardized tests, that may help determine and differentiate between MCI and Alzheimer's disease. Obviously, taking good medical history and physical examination may be useful, and then brain imaging, as we have talked about. So, the most effective approach appears to be using structural imaging, preferably MRI as a first-tier method, followed by molecular imaging techniques like PET scans to determine if the diagnosis of Alzheimer's is present, if that may be in play in somebody that has more severe symptoms. Now, senior assessments are done on people at certain ages, depending on, which age is chosen, depending on who the physician is that may be treating the patient, but 70 is often when senior assessments are done. So things like the test that we described before, the MMSE or the Montreal Cognitive Assessment, delayed word recall or clock drawing may be used to assess a senior patient's cognitive assessment. So what's the difference between these two tests? The mini mental status exam, MMSE, it's a 30-point questionnaire that evaluates orientation, object naming, attention and calculation, object recall, language skills, and ability to follow directions, and visual spatial testing. The maximum score is 30, and then depending on what the score of the patient is or applicant, you can tell what the level of impairment is. Scores of 28 and above are normal, 25 to 27 may indicate MCI, and 24 or less may be indicative of dementia. In the Montreal Cognitive Assessment, 30-point test is also used, and you can see it basically tests the same type features, and then you can see what the scores are for that test as well. But typically, the easy way to initially assess whether somebody's cognitive function is impaired are memory problems or word recall, which are commonly done. So visiting a doctor's office, the patient may be asked to remember 3 words and draw a clock for a specific time. And that's fairly typical of what's initially done. If some defect is noted in the person's cognitive function, then they may have more in-depth testing. So delayed word recall is certainly one of the initial ways to determine whether somebody might have a mild cognitive impairment. So a more extensive delayed word recall test would be to give 10 words to an individual. The individual reads the words, uses it in a sentence, immediately repeats it one time. Then the individual's attention is occupied for 5 minutes with some other task, and then they are asked to recall as many words of the 10 as possible without any time limit. The lower the score, obviously, the more severe the problem. Actually, studies have been done regarding the mortality risk, depending on the number of words that are recalled. A very low score is highly suggestive of dementia, and a score of 6 or above is considered normal. Articles in the insurance world have been written on underwriting the elderly and the utility of using delayed word recall. And at Gen Re, they've done many studies, and they have a lot of data and articles published in this regard. And based on their information, people that have 5 or less words remembered have an increased mortality ratio versus people that have remembered 6 or to 10 of the words, who have basically a nearly 100% or slightly above 100% mortality ratio. So we use the number, or I use the number 6 or better to determine whether somebody has a, quote, normal test. In delayed word recall testing, be wary of delayed word recall tests administered by paramedical examiners for life insurance applications. I've noted in the past that paramedics may doctor, and that's in quotes, or improve the results, especially on 10-word recall tests. You know, they want to help out someone who's applying for insurance, so they may be generous in recording how many words are remembered. And we have noted in the past that some elderly applicants with supposedly remembering 8 to 10 words out of 10 on the delayed word recall test were later found in the attending physician statement to have dementia. And when they signed, when it was a wet signature on the insurance form, now a lot of times it's an electronic signature, but when they were asked to sign the form, they had a very altered signature if they had signed it themselves, so that the paramed went ahead and forged the signature and signed it for them. So be alert, use your judgment and common sense if you get any paramed generated word recall test results. And this is just an example of someone who obviously had problems with a wet signature. You know, this does not resemble in any way somebody's actual signature, so they've lost the ability to write their name. So clock drawing is also a typical test that's used in assessing for mild cognitive impairment. And the person will be asked to draw a clock, and this is one of the old analog clocks. We're not talking digital here. So they've been asked to draw a clock face, and then they'll be asked to put the long hand and the short hand of the clock to show a specific time, and then points are given for how well they do with drawing of the clock. So this is just an example of how well or how poor a clock drawing may be. So basically you want to hopefully get a circle with hands that are placed in the right place, and that the numbers on the clock are arranged as you would expect in a normal clock. So these are typical, this shows an example of typical scores that would be given for either impaired or normal looking clocks. Mood changes are not typically a primary feature of mild cognitive impairment. The main symptoms of MCI involve cognitive decline, particularly in memory and thinking, without significantly impacting daily function. However, some mood-related issues can occur alongside MCI. When somebody's older, they may have lost their spouse, or there may be other factors in their life that contribute to depression and anxiety. They may be apathetic in certain ways. Other things may be observed, but generally they don't have significant personality or mood changes that are associated with dementia, where people may change completely how they respond to other people. You know, they may become very difficult, agitated, use foul language, and be abusive to other people, which was not their way of life in their entire prior life. So the more severe personality or mood changes may be associated with a dementia rather than mild cognitive impairment. So what if you forget your car keys? So forgetting car keys alone is not necessarily indicative of mild cognitive impairment. You know, it's not an unusual thing for most people to do. You have an occasional memory lapse. So that can commonly happen in anyone's life. Obviously, if this became more severe or with increased frequency, that people were forgetting things and became obvious to other people in their lives, they would want to bring it to the attention of the physician. But, you know, while it's frustrating to forget where your car keys, it's not automatically a sign of MCI. The same with forgetting the names of grandchildren. You know, it may be a common cognitive slip, but it's not necessarily indicative of MCI. May just be you substitute the name of another child for one of your grandchildren. You know, that's not an unusual event, so it doesn't automatically mean that somebody has MCI. What about forgetting the names of the 7 dwarfs? Again, not necessarily indicative of MCI, although every now and then I try to remember the names of the 7 dwarfs just to test myself. But you know, just may be something that's not particularly indicative of MCI. Or if I'm worried about my own memory, I can ask myself, how many characters on TV show Friends can you remember? Can you remember their TV character names or their real names? And you get extra credit for naming any minor characters, like Gunther. So now, what if you're unable to drive to the correct address? So being able to drive to the correct address to return home can be a more concerning symptom and may indicate mild cognitive impairment or another more significant cognitive issue. So, you know, if people start having problems remembering their address or where to drive the car, that can be an issue that needs to be investigated. So do they have mild cognitive impairment or early Alzheimer's disease? That needs to be addressed. You know, you may want to consult a healthcare professional when that kind of thing happens, and they may need to undergo more significant cognitive testing. Now, medications that may be prescribed in MCI. So there's a group called the cholinesterase inhibitors. So they inhibit the enzyme cholinesterase, which actually breaks down or metabolizes acetylcholine, which is in the synapses of nerves in the brain. And things like Aricept, which you may have heard of, are cholinesterase inhibitors. So I'm going to show you in a picture of what this actually does. Also, there's another group of drugs, primarily for Alzheimer's, that I've listed below. Since we're talking about MCI, we're not going to focus too much on them. But I'll just mention at the bottom a new drug that the FDA has recently approved for early Alzheimer's disease, LECANEMAB. So it's a monoclonal antibody, and it's been approved. Whether it will modify things significantly, we'll need to determine. But let's talk about Aricept. So again, I've spared no expense here, drawing my own picture. So let's talk about what Aricept actually does and why this would not be useful in Alzheimer's, but may be useful in something like mild cognitive impairment. So in blue, I've drawn a presynaptic neuron and a postsynaptic neuron. So as you can see in the brownish purplish color, the nerve impulse goes down the presynaptic neuron, right? Then there's these little green dots. That's acetylcholine. So that's the chemical that's going to boost the transmission of the nerve impulse from the presynaptic neuron to the blue postsynaptic neuron, which has receptors. And you can see those little cups there in blue are the postsynaptic neuron receptors, so that the impulse can pass from one presynaptic neuron to the postsynaptic neuron and keep traveling. So the acetylcholine that's in between the two synapses, or in the synapse between the two neurons, is the nerve booster. So you need a lot of acetylcholine to boost the transmission of the impulse, right? And this acetylcholine is recycled. But here's what happens. An acetylcholine esterase, or cholinesterase, as we talked about a little while ago, metabolizes the acetylcholine, but we want to keep, and that goes to the trash, but we want to keep as much acetylcholine as possible in between the presynaptic neuron and the postsynaptic neuron. So we want to recycle that acetylcholine and keep a lot of those green dots present, and that's exactly what Aricept does. That's all it does, is it keeps more of the green dots present, so they don't go in the trash bin, but they get recycled. And Aricept does that, and that's all it does. So, you know, in Alzheimer's disease, we talk about these plaques that can happen in the brain. Obviously, this drug, Aricept, isn't going to do anything about that. It strictly prevents the metabolizing of acetylcholine, as depicted here. Hopefully, you get the message from my drawing. So, why Aricept doesn't help in Alzheimer's disease? Because as you can see on the right, what happens to the brain in severe Alzheimer's disease, you get these amyloid plaques and tau tangles and damaged and dying nerve cells. Aricept can't do anything for that. All it does is keep the amount of acetylcholine higher. So that's why Alzheimer's and other dementia diagnoses are so difficult to treat. It actually affects the brain tissue and causes problems that way. And so the beta amyloid in Alzheimer's disease, as depicted on the right, causes plaques and other beta amyloid globs to be present in the brain, which affects cognitive function, thinking, and that's why people have much more difficulty. They actually have physiologic brain problems that are severe in Alzheimer's disease. So drugs aimed at treating amyloid deposits in the brain, as I mentioned, lecanemab, hopefully that will help with the beta amyloid that's deposited in the brain. And with time, hopefully this will offer relief and help to people with Alzheimer's disease. However, the cost is significant, and it may be as high as $26,500 a year. Medicare Part B will cover that for people covered by Medicare, but patients are responsible for 20% of the cost. You have to be for Medicare coverage, you have to be enrolled in Original Medicare or Medicare Advantage and have a diagnosis of mild Alzheimer's disease or mild cognitive impairment, which is severe, obviously. So hopefully that will offer some treatment in the future for people with more severe disease. Now, interestingly, drugs like Ozempic or glucagon-like peptide drugs may prevent cognitive decline and dementia. We're just at the very leading edge of determining whether these may be useful, since they offer some anti-inflammatory effects in the brain and for neurons. So GLP-1 drugs are known to reduce inflammation. They cross the blood-brain barrier and affect brain receptors. So maybe this will be helpful in preventing cognitive decline. So more to come on this. We'll see how this all works out. So I'm sure studies will be in process to determine whether this can be useful for brain diseases, as well as treating diabetes, weight loss, and all the other things that GLP-1 drugs are useful for. So here's what our Optimum manual says. It's slightly different than what I said in my talk, but we have, if you on a delayed word recall, you get 5 to 10 words. We give +0, 4 words, refer to the MD, but usually +75, and 3 words or less is RNA. I use a slightly different grouping myself, since I'm basing it off of the work that Jen Rhee did, with 6 to 10 words being normal. Clock drawing, you can see the points and how we would administer debits for that. And then we have debits for results on the mini mental status exam or the Montreal Cognitive Assessment. So our takeaways today, I think we learned what mild cognitive impairment is and how we would diagnose it. How does it differ from Alzheimer's? And what tests are used in insurance to discover MCI, what the treatment is, and why Aricept may help MCI but doesn't necessarily help in Alzheimer's disease. So thanks for attending today. If there's any questions that we can answer on mild cognitive impairment, please don't hesitate to contact us.